Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and I want to talk to you just for a moment about some of the things that you can do to help patients understand the difference between a prophy and periodontal maintenance. We get this question all the time from our coaching clients. You know, how do I, first of all, how do I transition patients from a prophy to perio maintenance, and then how do I help them understand why it's different? And the advice that we give is if you have a patient that's in a prophy that really should be in periodontal maintenance, it's really the appropriate time to move them into periodontal maintenance is after you've done some retreatment, so after you've done some scaling and root planing. So if you're not ready to move them back into that just yet, then just keep them where they are. But when it's time to re-enroll into periotherapy, active therapy, scaling, root planing, then that's the appropriate time to place them back into perio maintenance. But there always come up questions of how is this different? And it first starts with us, right? It starts with the hygienist and the doctor understanding what is the value of periodontal maintenance and what value do we place in it and how do we feel that it's different. So I'm going to give you 4 things that might help you explain to patients and help you understand too what's different about the periodontal maintenance. So one is explaining to the patient why it's different, because you might get that question, right? Explaining to them what is different. So you might go through some of these steps that I'm going to share with you now. And what you might do is you might tell them that you're actually able to access that bacteria that's really deep under the pockets, right? So if you have a patient that has some residual 5mm pockets and maybe they're not active infection, but they're still there, that's more than what you would do in a prophy, right? So that's something you can certainly accomplish in a periodontal maintenance. So one of the things that's different is you're able to access those deep areas, okay? Some of those deep residual areas that you're always monitoring and keeping a close eye on. Tell them what you're doing as you're working, okay? So when you get to those areas, tell them what you're doing. When you get to those areas, then share with them. When you're using your ultrasonic, say, okay, so now this is one of those areas that is healthy right now, and we want to keep it that way. So I'm going to go down to the base of this pocket, and I'm just going to gently disrupt this bacteria. And so really walking them through that so that they see this is different than a prophy. 3 is tie in the risk factors, right? So for your patients that have any of those inflammatory risk factors, diabetes, history of heart disease, history of cancer, obesity, stress, lack of sleep, lifestyle, all those things that create inflammation in our bodies, point that out and really connect the dots. Because you have X, because you're in a high stress job, it's important to, number 1, come in frequently so we can access these areas and really disrupt this bacteria. So tie it back into their risk factor of why they're in periodontal maintenance rather than a healthy prophy. And then 4 is really what you can do if disease creeps up. Okay, so explain to your patients what you can do if infection appears. Okay, so the great thing about periodontal maintenance is if you have 1 or 2 sites that relapse, you can treat that within the periodontal maintenance. Now, when you start to see 3, 4, 5, 6 areas or generalized relapse, then you need to consider taking the patient back through active therapy. But if they were in a prophy and you saw 1 or 2 areas, that would need treatment. If they're in a periodontal maintenance, then all of a sudden you're able to treat that right then and there. And if you will review the descriptor of that code, you'll see. So that's the great thing about periodontal maintenance. If things creep up and they're very, very localized, you can treat that at that time and then check it again at the next periodontal maintenance. So I hope this helps give you 4 things to help your patients understand the difference between a prophy and periodontal maintenance.